Hello everybody, Dr. Jeff Lynch with MckinneyDentist.com, and this is Dental Implant Talk. Today I'm going to answer the question, does diabetes affect me getting an implant? Well, the answer to that is maybe. Let me start by describing diabetes and explain a little bit about what it does and some measurements and tests that we can do to determine whether it's going to affect you or not. Diabetes is a metabolic disease. It affects your body's ability to take glucose or sugar from your bloodstream and transport it into your cells to be the energy for those cells to work. There's two types of diabetes, type 1 and type 2. Type 1 is where your body's pancreas no longer makes any insulin at all. Type 1 diabetics take insulin through injections or through an insulin pump on a daily basis, and they have to monitor what they're eating and adjust their insulin levels accordingly. Type 2 diabetics, their body still makes insulin, it's just the cells don't use it as well anymore. The insulin will slowly incorporate or place sugar into the cells, but not enough to keep the amount of sugar in the bloodstream down. So I'm not going to really differentiate between the two of those here, but what is important to know is how well patients control their blood sugar. When we say they're out of control, generally what that means is the blood sugar levels are higher, meaning you're consuming more sugar than your body is using and putting into the cells. Over the long period of time, that causes problems with the small blood vessels called capillaries. Those capillaries will clog up. That's what causes diabetics to potentially lose feet, because the blood supply in the extremities, the feet and the fingertips, slows down and they don't get enough blood to their toes or their feet. Something happens, it doesn't heal, and they end up losing it. So I digress. The blood sugar on an overall 3-month average is measured by something called hemoglobin A1C. This measures the average amount of your blood sugar over that period. What we want to have from a surgical standpoint, whether it be for an implant or any other surgery procedure, is we want your hemoglobin A1C to be under 7% or a 7. Anything between 7 and a 8.5 puts you at a higher risk of developing at least one complication during a surgery. If you're above 8.5, we can't do any type of surgery because the chances of you having a complication or a severe infection are very significant. So if you are a diabetic, your blood sugars are under control, you're taking your insulin, measuring your blood sugars, or taking your diabetic medication, don't eat too many carbs, and you keep your hemoglobin A1C below 7, then absolutely you're at no greater risk than a non-diabetic. Numbers above 7, need to work on that for your dental and your overall health. So I hope that answers the question for you. Look forward to meeting you at MckinneyDentist.com.